of Monitor Your Health, the program where we educate the public on issues around hospitals, around your health. So today we're going to talk about, the laboratories, the laboratory and, our samples, what happens to them. We have with me in the studio, a microbiologist, and my name remains Dr. Femi Ogunremi. So I welcome you all to this engaging, show today. So I want to welcome Dr. Olugbeminiyi, Dr. Olugbeminiyi, like she wants us to say it. You're very much welcome, huh?
Thank you very much. Good morning. Glad to be here.
Thank you so much. Can you introduce yourself to our audience today?
I am Dr. Olugbeminiyi, Dr. Olugbeminiyi Afolakemi. I'm a consultant clinical microbiologist with the National Orthopedic Hospital, Igbobi. So it's good to be here.
Yeah. Thank you so much for giving us your time. We want to look into the laboratories through your eyes. So we have you here today to see what goes on behind the show. We want to know what you do with our samples and things. So when we talk about laboratory, maybe investigations or tests, what do we actually mean?
Okay, thank you. Good morning. Again, I think I will start by saying this, that when we talk of laboratory medicine, we are talking about a field of medicine that we term pathology. And what is pathology? Is that branch of medicine that studies and diagnoses diseases through the examination of maybe surgically removed organs, it may be tissues. When it comes to autopsy, this will mean that under pathology, we have various units, we have various departments that deals with different things. Under pathology, we have those that look at infectious diseases, we have those that look at the cells, we have those that look at the blood, and then the general chemical composition of the body. So this is basically what we do in lab, depending on the kind of test that you want carried out. The unit that is responsible for that takes hold of the sample, which can be any of the body fluids or organs, and then they perform examinations on those samples. And then they aid, what we do in essence is to aid diagnosis and the management of the patients. So we work hand in hand with the physicians to aid their diagnosis and the management of patients. So it is a total patient care. Pathology basically is the study of diseases. So we study the cause of disease, the origin, and the nature. So it's every aspect of patient care, from diagnosis to treatment to prevention. Thank you.
Thank you so much. So it's interesting because, you talk about, every aspect of medicine. And a lot of the time when people come to the hospital, they believe that once they've seen the clinician, unless they see the clinician, things have not, they haven't actually engaged in their care. And then you guys are there in the laboratory. We hardly see your face, we only see when you sign things, and then, but we know that they take samples in and out. There's go and do your test. Sometimes they ask for blood, sometimes they ask for urine, sometimes they ask for stool, and like you mentioned, it could be the tissue. So what I know you've talked about the pathology. So are there differences for people to understand in terms of when you take blood, or you take urine, or you take swab, or you take all these samples? Are there different units? Apart from generally we're talking about pathology, are there units that we need to understand how to engage with them from looking from outside when we're not a medical person?
Okay. There are 4 major departments under pathology. I will start with histopathology.
Right.
These are the ones that look at the biopsy, or maybe they send biopsy specimen, and then they can tell us, oh, these are the kind of cells we can see. They look under the microscopes, and these are the same sets that do autopsy after death. They use whatever they discover. They use the sciences of discoveries from the dead to help the living. That is histopathology. They deal with tissues. Yes, they can do fine needle aspiration too. They want to check, oh, there's a fluid here. Let's see, is this fluid, is it benign? Is it cancerous? That is histopathology. We have another unit under pathology called hematology. They deal with the science of blood transfusion, and then every other thing that relates to blood cancers, and the treatment of blood infection, blood and cytologists, pathologists. You know, they are these same people that look at the leukemias, the multiple myelomas. You know, they make their diagnosis from looking at blood film, and then blood transfusion generally. And then we have the chemical pathology. These are the ones that look at the chemical components of blood, meaning that in chemistry, we want to do electrolytes, urea, creatinine, the thyroid function test, the prostate. They look at the chemical components of a patient to make diagnosis. Then we have the microbiologists. These are the ones that aid and manage infectious diseases. Any body fluid can be brought to the microbiologist to look at. We want to check this. Is there something causing infection here? Any body fluid at all. And as far as we are concerned, when those specimens come to us in the lab, it is not just that stool. It is not just that urine. It is not just that blood. We see a potential patient right in front of us, and we treat as such. We want to help the physician to know what is going on. Invariably, whatever we see in your body fluids has a lot to say about what is happening in the body. And that's the way it rolls.
Right. Thank you so much. So I have malaria now, and I know I have what I see as a patient is I have fever and then body aches and all that. So coming to the laboratory, or if I go to see a physician, the physician will see me and say, oh, you have this and that. But then he then ask me, go and do the blood test or whatever. So when I take this, when they take sample and take it to the laboratory, what do they do? And how do they then come and say, okay, that is malaria, or that's typhoid, or maybe it's something else? How did they, what sort of processes are involved when we look in the laboratory?
Okay. Various processes go in depending on the kind of test that wants to be carried out. Now we are talking about malaria. If you see a physician and it looks like, okay, could this be malaria? Let's check it. And then they bring your blood to us. Now we have various means. We have the rapid diagnostic test that use kits. And at the same time, we still stain. Those are some of the processes we do in microbiology. We use stain, we use culture, various things to come to a conclusion. So we can do a rapid diagnosis test using the kit. And we also stain. We stain a slide, and we make our processes and look under the microscope. What are we looking for? We are looking for the malaria parasites. We are looking for the malaria parasites, which we see under a microscope, and we'll be able to tell a physician that, oh, I have seen a malaria parasite here. Oh, this and this is what I have seen in this patient.
Okay, so that's what then gives us the final conclusion that actually this is malaria, and it's not something, right?
And it's not something else. Yes.
Okay. So, are there any other importance attached to laboratory involvements in patient care that I need to know? Because what happens in Nigeria is obviously when a patient, or not only in Nigeria, anywhere in the world, when a patient goes to see the physician, sometimes we forget that it's like going to the shop. You want to go and buy things. You're going to spend your money, especially in Nigeria where capitalism is the rule of the game. You have to pay for your care. So I've come to see a physician. I didn't know about the laboratory. All I know is I have pain somewhere in my body. And I thought, okay, well, give me painkiller and that will resolve things. But when I get there, he's now telling me, no, I'm not going to give you painkillers. I have the money and I want to buy painkillers and sort my problem out. But the physician is not telling me now, no, It's not about, you know, the painkillers. I need you to go and do mirage of investigation. And then I will have to go and look for money to actually sort this out in terms of payment, because I've come to purchase. Why is it important for me to actually put my money into this? Since, I mean, to go and look for the money to pay, why can't they just treat me? What are the important things that I need to know as a patient in this area?
Okay, thank you. Laboratory is very important when it comes to the care and management of patients. You know, we live in a community where everybody, once I feel this pain, oh, I know a woman, when she had this kind of illness too, these were the drugs she took. And then I go ahead and take those drugs, and they may not even get better. But the importance of the laboratories comes when you see a doctor and a doctor says, I need you to do the following test. The doctor is saying, I need to know exactly what the problem is. Okay, let's look at the issue of the current pandemic now. And everybody knows that when you are down with fever, the first thing to think in the time of pandemic is COVID and not malaria, because the presentation looks similar. The presentation looks similar. So in that kind of a case, you need the lab to say that, oh, in this patient, I've done malaria parasite, is negative. Let me take a swab and check for whether we are dealing with COVID-19. The lab helps your diagnosis that, oh, this is what we are saying. Somebody comes and says, oh, I'm having some lower abdominal pain. Okay, they say, okay, give us your urine. Let's see your urine. And then we look at the urine. Even from the color of the urine in the laboratory, we're already making our diagnosis. Oh, this is the way this urine appears. It's saying something. Oh, maybe this patient has a urinary tract infection. Let's look at it. Is there an organism here? And then we check and say, oh, there's an organism inside this urine. It's so. It is E. coli. Okay, what do we do? And then we go further and look for antibiotics that will be able to cure that infection. And then we put that to the doctor. The doctor's work becomes easier. Oh, this is what you have, and this is a drug. Even when there are even sinister things that that may not even be infections. An ordinary urinalysis can be a pointer to so many things going on in the system of a patient. Ordinary urinalysis can show you that there is blood somewhere. It shows there's protein somewhere. And then we begin to dig. Why is this patient having protein in his blood, in the urine? Why is this patient having blood in the urine? Do we need to dig more? Is there an infection? Or we are beginning to have problems with the kidneys? All this will help the doctor to make up their minds as to what is actually going on in the system of this patient. Like I told you earlier, we don't just look at it as sample, it's just urine. No, a patient is right there. As far as we are concerned, we are looking at a patient, and we want to ensure that we know what is wrong with this patient, and this patient gets correct treatment and management.
Thank you so much. I think that's, in fact, that sounds quite succinct enough, because, like I said, when I go to the doctor, I still have my own doctors. When I go to the doctor, what I'm looking at is, I've got this money and I want to go and spend the money. Please help me spend it well. What you've described here is, this money is even not well spent unless they know precisely what they're treating. So you give me painkillers, I can use the painkiller for some time, and that might not solve my problem, and I would have lost that money. And then I will come back again, and then maybe something else. So we'll be guessing. So what you do in the laboratory, from what I gather from this, is you actually get to the root of it, and then you address, we're able to address the situation as it were, as in what's actually causing the problem. Thank you. Now, yeah. So what somebody will be now looking at is, okay, now I've done the test. A lot of the time, some people do tests, and by virtue of what happens, is it that they do not even understand the result they're getting. As in, the question then would be asked that, so I have gone to do tests. How do I interpret my results? Because I realize in Nigeria, people Patients just walk into some laboratories. Whether that's even right, I don't know, which might be a question that might be able to help us to answer. They walk into laboratories and said, I want to do malaria test. And this is done for them. This could be maybe laboratories not regulated, or it might be whatever, but the people working and they do. And then they get the result and they don't even know how to interpret this result now, and then they probably interpret it wrongly. So how do we get, what's the normal process? How do we get, our results, appropriately and adequately, dealt with to get the results that we want?
Thank you. Ideally, because so many things are not regulated, so everybody more like, everybody goes about something, sends a patient to you and says this and this. And then when you carry out the test, you are supposed to send the result back to the person that sent the patient to you and do your report. This and this is what I have said. And then the patient, the doctor, the physician communicates with his patient that, oh, I have the results of your test. This and this and this is what it says. And these are the things we are going to do to take care of you, to treat you, to arrest the situation, and probably even look for preventions later on. But here, things are not regular. People just walk into different laboratories and do some tests and then keep their tests in their house. Probably the person there is not even able to interpret the results for them, or even tell them, take this result to a doctor to interpret. It is not every time that you meet a doctor in the lab, so we have those kind of issues with patients getting enough information about what they have in their hands. Honestly, when I get to those kind of situations, and we see these patients who are just coming in, they haven't even seen a doctor. They just want to do tests. It happens. It's just now that we are beginning to have a better system, that even the doctor will make requests and then we can get the request even on the system in the lab. And as soon as our results are ready, we put the results on the system and the doctor sees the results immediately. So we have this kind of misnomers, everybody just walks in. I just want to do it. Nobody told me to do it. I just want to do it. It also means that when they get the result, there's a risk of not even knowing what to do, or even the risk of going to wrong places to go and look at it. So this is what they gave me in the lab. Give me something for this, which is not the way it's supposed to run. We are supposed to communicate to the physician this, and then they explain to the patient, this is what is wrong, and these are the solutions. These are the way we are going to manage the situation.
Thank you. So there should be a collaboration between the laboratory and the doctor, so that there's a pathway of referral, which is what I'm getting from what you're saying. So to the public, it's important for you when you do a test, or you go to or somebody sent, when you're going to have a test, let it be like there is a physician that is referring you. And then, like you hear now, there's need for a kind of bilateral engagement whereby a communication goes to the laboratory, and that communication, so the result of that communication needs to get back to the to the physician, so that they can adequately give you a kind of treatment that you require. Now, Dr. Olugbeminiyi, I had a situation, I think last week, where somebody came to to my practice, and then they wanted to screen, breast screening. And then this lady told me that she had a lump in the past. I think 2 lumps, she said, and these lumps were being removed by some sort of doctor. And then in the end, I asked for results, and they said, no, nothing was done with this tissue that was removed from her. A young lady, actually. And then now she has another lump, and then puts me in a precarious situation, because she wants to screen. Now she has a lump, so I had to refer her to to do obviously, that's more than screening as far as I'm concerned now. So what do you say? This is a kind of advice, at the same time a question, either to our colleagues or even to the public themselves. What's your advice in this situation where things, I mean, people remove tissue and then they just literally chuck it up?
You see, exactly what I was saying. You know, this is a very, very dangerous thing that was done for this young woman. I have seen that kind of situation before. Because as at the time, who knows how many years ago the excision was done. When that excision was done, it should have been sent to the histopathologist who will look at the cells and tell you that, oh, this is benign. Oh, this is cancerous. Now the lady is in a tight corner. Because who knows? We all know that in the management of breast cancer, early detection remains key. And now imagine a young woman, maybe 4 or 5 years ago. If that thing was going to be cancer and it has been discovered 4 or 5 years ago, the management was going to be different from what it's going to be now. If you are just going to get another lump after 5 years, and now you not want to start treatment and management, most likely the situation has gone past what it was 5 years ago. So I just want to say that we've seen so many of these kind of situations, honestly. We've seen quite a lot of them. When tissues are removed in the body, it means that there is something wrong with those tissues. And the best thing to do is to find out what exactly is wrong with the tissue so that you can start a management plan for this patient. There are so many people who are living well around who got some of these tissues diagnosed in early stages and had treatment and are living fine. But when some of these things are not diagnosed at the early stages, then the treatment becomes difficult. So I want to speak to our colleagues and people that do excision and take things from patients. Encourage your patients. Yes, I also know there are patients who will get some of these things and they say take it to the lab. Patients have told me literally how they threw samples away. They threw it away. As far as they are concerned, what is wrong with them has been removed. So why do I need to spend money again? They will literally throw the samples away and go home, not knowing that some of these things can come hunting in another 5 years. So when the samples are taken, encourage your patient, enlighten them on why they need to check what it is. If it goes and comes back and say, oh, it's a benign thing, go. If it goes and comes and says, oh, this looks suspicious, then we know what to do to manage and save the life of that patient.
Thank you so much. It got me really worried when I saw that day, and I was like, why is this? And then this lady was saying she wanted to go to the spoke to that same doctor again, and the doctor was like, come, and that needs to be removed. And I said, look, yes, it might need to be removed, but at least if it's removed, the only good thing you can do is to help this patient by sending it to the laboratory. We're not even sure what you're chopping out. And then for the patient, I know, just like Dr. Ogunremi has just said, some of us have a kind of impression, kind of mindset. And I know it's all driven by the fact that you have to pay. And then you can say, oh, is it worth me paying my money for this? Remove the problem and that's it. So be it. No, the issue can be something that is lingering on. Because the idea is to get it early. If there's anything there, get it early and then take care of it and deal with it. And then it's behind you. Thank you so much, Doc. So as we're getting to the end of the program, obviously you've said a lot of things here today. Some of it, including things like the structure that we have in place in terms of the regulation. Some of these things are not well regulated, and that's actually causing a lot of problem in some areas. What would be your advice to to our regulators, to the governments? To bodies that can actually, probably they're hearing us today and then they're thinking about how can they actually help situation in the country to improve our health system, which is a bit chaotic at the moment. So what would be your advice to them looking at your department in the mix?
Thank you. What I would say is that, regulatory bodies, you will hear people jokingly say that, Don't go to that mushroom lab, because they believe that the things that are being carried out are not standardized. And there are rules, there are bodies that ensure that these places are standardized, because as long as we continue to have substandard laboratories, we continue to have problems in the management of patients. So I will still want to say that, yes, we know we have regulatory bodies and they are working, but I want to encourage that they do more. There are so many labs who don't even have accreditation, who are not even supposed to be doing anything, who are not even supposed to be doing any test at all. I just want to encourage that the regulatory bodies continue to see to the fact that any lab that will be made to function to take care of patients and take samples, they get accredited and they ensure they have good hands that can man and take care of these so-called samples coming from patients. Like I told you, as far as we are concerned, it is not just that urine, it is not just that stool. That stool says a lot about your health. We see it as a potential patient standing right in front of you. As far as that stool, as far as that urine, as far as that sputum is concerned, as far as that nasal swab is concerned. The era of COVID has made us to see how important oropharyngeal swab is. So you see a potential patient right there in front of you, and we must handle it as such. Ensure we get trained hands and ensure that laboratories are visited for accreditation regularly, so that people can advance, do more, get people to go for trainings, so that as the world advances, we too are advancing. We are moving forward, ensuring we get more equipment, ensuring we get more training and more education for our staffs.
Thank you so much. So, and then for the patients, your last word for them before we now round up for today.
Okay, I just want to say to the patients, yes, we know that economic-wise, somebody will just say they should just tell me what is wrong and give me drugs. But we also know that laboratory investigations can help you to hit the nail on the head. And I just want to advise, yes, I know economically it is difficult. Most people don't want to come to the lab because, oh, I have to pay this, I have to pay that. But I want to encourage you. It's a problem that is known, that is solved. So help your physicians in the diagnosis by coming to run your test. Once the diagnosis is made, your treatment becomes better. I know financially it may be difficult, but it is my prayer that things will get better economically so that we'll be able to take care of ourselves the way we ought to. When they give you samples, please don't throw the samples away. Bring it to the lab and let's see what is in there. Thank you.
Thank you so much for joining us on today's program. We're really, really appreciative. And then to the viewers, thank you so much for always being there. Thank you for joining today's episode. We've talked a lot about your sample, and we know that sometimes it can be an abstract because because just see this face taking sample from you. From there, you don't see your sample again. Then you see this paper bouncing around, and there are people inside in white clothes trying to read in between the shadows of your blood and the shadows of your teeth. Now, we find that it's really important. It's absolutely crucial and important for us. I always tell people, medicine is not like a yo-yo business. It's what you tell me by speaking to me that makes me know where to attend to in your body. And at the same time, it's what your sample tells me after I've taken the sample that then directs me to know, okay, this is the next thing I need to do. So it's really important in most cases for us, to work our way through that process. We ask a question, you tell us answer, then we examine you, then we do your investigation, and then we treat you. There are 4 ladders that we have to go through as a physician. So laboratory is as important as you telling me the accurate information. On that note, I'm going to end it here by thanking you, for always being there, and then also wish you a wonderful weekend and a brilliant week to come next week. Thank you so much.
Thank you.
Thank you, Doctor. Bye-bye.
Thank you. Bye-bye.